and guests to turn off the cameras. You should turn on your camera and microphone when you speak, but please turn them back off again afterwards. Could I please ask Democratic Services to mute everybody and begin recording? Okay, thank you. Good afternoon, everybody. Shemai Pawb. I'd like to welcome you to the Regen and Scrutiny Committee meeting Tuesday, 23rd of February 2021. Please note this meeting is being recorded and may be broadcast via the authority's intranet site. The images and sound recording may also be used for training purposes within the authority. Agenda item 1, apologies for absence.
Yes, Chair, we've had apologies from Councillor Julian Amos, Councillor John Thomas and Councillor Kevin Gibbs and Councillor Gareth Lewis and Hilary Hopkins, our co-opted member.
Okay, thank you. Item agenda 2, declarations of interest. Members are reminded of their personal responsibility to declare any personal and prejudicial interest. I'd like to refer members to notes A and B. Are there any declarations of interest?
Yes, Chair. Following advice, although I am a bus pass holder and live in Bedlam, I don't need to declare an interest in the item on subsidised services, so I will be staying for that item. Thank you.
Thank you, Councillor Colburn. Moving on to item agenda 3, update on responses to coronavirus. To consider the attached report, pages 5 to 16. I'd like to invite Deputy Leader Alan Owen to present this, please.
Yeah, thank you, Chair. If you note, the report is quite a small report, and then we go to the appendices of update. If I can start, and then I'll probably bring the cabinet member in. If I can give you an overall view based on paragraph 4.4, where we left off our discussion last time about the general effects and the measures taken around coronavirus the last time we met. Obviously, we went through a process of the first Welsh pilot of whole town testing back in November and December last year as a local authority. At the time, the rates of increase of the virus were going up sharply, not just in Merthyr, but in Cwm Morgannwg, Wales and the UK. It was a very successful pilot which we undertook, and in total 38,340 people had a voluntary test during that process. As I say, it was at the time when the virus was increasing dramatically. Merthyr Tydfil, unfortunately, saw one of the highest rates of infection per 100,000 population, which reached a peak probably in about the second week of January, and Merthyr had a rolling rate of over 1,300 on a 7-day rolling average per 100,000 population. We then saw a dramatic decrease, which has continued from this time, and a lot of this has been attributed to the amount of people that were actually identified as positive during the mass testing regime, and were actually taken out into a quarantine basis. That figure at this point in time is below the Welsh average, and today it was reported that the 100,000 rolling average has dropped to 61.3%, which you'll agree is a dramatic decrease. Obviously, we've moved into a different phase in fighting the coronavirus and the pandemic now, and as well as containing the rate of increase and encouraging the rate of decrease, then everything is now moved towards vaccination. As at today, in Cwm Morgannwg, the vaccination programme has been very successful, and 126,000 doses of the vaccine have been administered. 117,000 has been the first dose, and the rate of progress in administering the second dose is very impressive. Out of the vaccination programme, then we have the mass vaccination centres, but primary care has also been very, very critical in delivering the response. And as at yesterday, 60,000 of the doses that were administered has been through primary care sources. There's been a break in the mass vaccination process in Cwm Morgannwg based on the distribution, not the amount of vaccines available. And there was a break of 3 weeks in the centre provision at Regeneration. That will start again on the 1st of March and will continue for the duration of March, but that'll be based on giving second doses of the Pfizer vaccine, because obviously you've probably seen extensive coverage in the news. It's a case of clearing the decks now on the first phases of vaccination, and from April there'll be a different pattern of vaccination based on the AstraZeneca vaccine, which will replace a lot of the Pfizer provision. There's going to be a new process of community testing, which will, which has come to Morgannwg. Apologies, Chair. As Cwm Morgannwg, we're going to be participating in from next Monday, and there'll be 1 month of community testing, not that fast whole town testing that we saw in November and December, but split over 5 community facilities over a 4-week period. So more information will come out to elected members about that process and the comms to the public in the coming days. If there aren't, well, do you want to stop there for questions, Chair, and then perhaps we can go on to the update from the other officers?
Okay, great. I think the best way to do it, maybe go through the different pages, because there's different officers for the different items. So is there any questions on pages 5 to 7? Malcolm?
Yeah, apologies, Chair. I haven't got the paper in front of me in that respect. In a minute, I'll look it up. But I just wanted to ask Alan a couple of quick questions on what he said so far. Is that okay, Chair?
Yeah. Go on, Mark.
Yeah, very impressive numbers on the vaccinations. Very pleased to hear that. Do we have any indication on the number of people that have declined the vaccination?
Sorry, Councillor, could you repeat that last thing? You broke up a little bit.
Did you have a figure for the number of people who have declined to have a vaccination so far?
I do have a figure for Cwm Morgannwg, but I'd be reluctant to share that because the information I took it off was officially sensitive.
No, that's fair enough, thank you. Yeah, I'm also pleased to hear that the community testing facilities are coming back. So that's going to be scattered across the whole borough as previously, is it?
Yeah, we'll be using a spine of facilities up and down the county borough, councillor. So at any one day over the 4-week period, there'll just be one facility open, which is sort of similar to the whole town testing. The only difference is we had Regeneration running simultaneously.
Okay, thank you.
Thanks, Mark. Is there any questions on page 9? No? Any questions on page 10? I got a question. It says number of price gouging profiteering incidents. I just wondered if somebody be able to tell us a little bit about what was happening with that.
Yep, I'm happy to answer that, Chair. at the very beginning of the pandemic, members may recall there was significant press coverage of hand sanitizers and small shops up in the price. We had the same thing with toilet rolls, flour. So it relates to the beginning of the pandemic. These figures that we're referring to are cumulative figures that have been since the very start. So at the very offset, we did have a number of complaints where we felt that businesses were taking advantage of the pandemic and were increasing their prices. And what we would do then is we would refer that into the Competition and Markets Authority, who were taking a national view as to where the shortages were being exploited. What I'm pleased to say is obviously that was at the very start of the pandemic. And thankfully, since that initial start, supplies were more steady, and then the amount of complaints completely dropped off as availability increased. With the most recent lockdowns, thankful to say there are no price gouging complaints, and things like hand sanitizers, face masks are more freely available, and the scarcity isn't there, so therefore the competition isn't as great as it was previously.
Great. Yeah, I noticed they with lots of different things, especially like building materials. They were really scarce. Any questions on page 11? Alcam?
Sorry, Chair. Yeah, I just wanted to comment on Paul's remarks about the price gouging. Yeah, I can confirm that as someone who uses cash and carries to stock my shops, that initially there were massive problems obtaining a number of items. That's all cleared now completely. There's no shortage of any items in any of the supply chain as far as I can see. So hopefully that issue's resolved itself.
Excellent. Any questions on page 11? I have one. The town centre business digital project. Could somebody just tell us a little bit about that and what type of projects have been supported?
Yeah, I can pick that one up, Chair. Yeah, so on the town centre digital as part of the 365 money, which is on the back of our successful delivery of the tri-thematic programme within the town centre. This is additional funds which have come available, which fall into 3 themes, which is public realm, meanwhile, digital and business recovery. As part of the digital, we're looking to carry out a feasibility report in terms of digitalisation for the town centre. One of the projects that we are looking at the moment is a buy local, support local, promote local platform for not only the town centre but Merthyr as a whole as well, creating virtual marketplaces where businesses can then still trade online at this very difficult period for businesses being unable to open. So that's something that's moving ahead at pace, and we're working with our partners within Tidville Training and MTech to deliver on one of those projects.
Excellent. That sounds great. Thank you, Lance. Yeah, moving on. Is there anybody got any questions on what Lance said? No. Yeah, moving on to page 13. Is there any questions on page 13? No. I've got a couple around the modular homes for the NLC. Initial conversations were around the NLC being redeveloped, or one of the blocks there. Now it's talking about 6 modular homes. Can somebody just let us know regarding that, please?
Yeah, if I can. Oh, sorry, one Deb.
Yeah, we're currently working with the Blaine Gwent architects to scope the potential of converting one of the blocks of flats in line with our conversation that we had when we had the briefing meeting with you, Lee, and some of the other elected members. The plans remain the same, to re-establish that development, and we're in the throes of the actual design of it and what it could look like, with a view to producing some visuals on it. and we're probably 2 weeks away from agreeing the final public consultation plan on it, and obviously we'll come out and speak to you guys around that as well. So we just push in for some more visuals to give people proper context on it before we go out to public consultation.
Okay, great. Alan, do you want to come in there?
Oh, thanks, Chair. Yeah, the 6 modular properties are different. It's a separate scheme to the NLC. It's a partnership scheme with Merthyr Valley's Homes to put 6 modulars on some of their land.
Yeah, it got a bit confusing because it said phase 2 funding originally designated for conversion of NLC, now being considered for additional 6 modular homes with MVH. I didn't know whether that was the same thing and you moved to the modular homes. Or...
No, apologies for that. I think it's just a little bit of clumsiness in the description.
Oh, that's fine. Yeah. In terms of what you've just mentioned, just on the line below it says 8 units. I had a meeting with Merthyr Valley's Homes yesterday. Now I obviously it's going to be 6. Is that funding there? Are they being purchased? The 2 other modular homes, will they be going somewhere else?
No, the other 2 won't be purchased. It was all wrapped up in one scheme, but there were planning considerations which decreased the number. So okay. Obviously any addition would be subject to a different application.
Okay, I noticed they've set a Facebook page up now for community consultation, started yesterday, so great. Malcolm, do you want to come in there?
Yeah, thanks, Chair. Yeah, my question was regarding the number of households in temporary accommodation. There seems to have been a big increase in the numbers in bed and breakfast. Was that a result of winter pressures, or was there another factor behind that as well?
Somebody answer that question.
I can answer that. So no. So I'm Erin. I'm the housing solutions team leader for Merthyr Council. So the temporary accommodation comes under my remit. We've seen an increase in relationship breakdowns within family units based on the isolation caused and the strain on families due to the COVID pandemic. So that have increased our figures for one. And we also have a high level of prison leavers coming out of prison as well. So since Christmas, January and February, we've seen a lot of cohorts being released in clusters. So that have also had an added increase in pressures on our temporary accommodation.
Okay, thank you for that.
Okay, thanks, Margot. Thanks, Erin. Just at the bottom of page 13, it says about the 40k Welsh Government Phase 2 funding at risk if you can't complete on the project. Has discussions been had if that could roll over into the next financial year? Anyone pick that up?
No, that money will be lost now, Lee.
That's unfortunate. Thanks, Alan. Moving on, any questions on page 14 and 15 regarding the mass testing? No? Malcolm, sorry. You're on mute, Mark.
Sorry, Chair, it's a legacy hand if it's still up.
Okay, no problem. Okay. I think I got a couple of questions. Numbers of testing, how many in terms of the positive test, do we have the data on how many people had a lab test following a positive result in the mass testing, and what was the percentage of that coming back positive as well?
Yeah, if I can pick that up. Obviously we know exactly what the figure was in relation to the amount of people who actually tested positive for the LFD tests. It's not quite that clear cut about the amount of people who actually had the follow-up test. Because it did appear that we had quite a large percentage of lost to follow-up. Those people who didn't actually then take the PCR test which was the lab test that you referred to, Chair. There was a slight anomaly, mind, because obviously this goes through the DHSC, Department of Health and Social Care System, with the UK government. But when a positive lateral flow test was reported by text, then we found out 2 weeks into the testing process that it refers the individual to actually make contact directly with the system in place to book a PCR test, the same as anyone would if they thought they had symptoms, as opposed to refer them back to the centre where they had the lateral flow test, where obviously there was also the PCR test. So we can't actually corroborate the two figures, but the loss to follow-up figure in Cwmtaf was quite high. It was about 50%, but we don't really know if that's accurate because of the slight inconsistencies between the two data sets.
Okay, thank you. I think you may have said this earlier. Do you know how many people had tests? Not how many tests there were, but how many residents had tests? You're on mute, Dal.
That's the first week really well, Chair. Yeah, there were 38,340 tests carried out. We have to assume that they were all residents, but we can't be totally accurate with that because obviously we didn't call for any proof of residency when people were taking tests.
Yeah, I think my question. What I'd like to know is how many, there's 38,000 tests, how many different people had that test? There wasn't 38,000 people, was there like 10,000 who went, I don't know, 3 or 4 times? Do you know what I mean?
We have detailed figures about whether or not the same person took a test once, twice, 3, 4, 5 times. But obviously we haven't published that data.
Could we get sight of that data, if possible?
I can get sight of some calculations over the time period, yes.
Okay, brilliant, thank you. Is there any other questions on that? No? Right, okay. Moving on to agenda item 4. Committee discussion, changing the start time of future meetings. I've asked for this to be brought forward because it's been raised as a problem in other committees, and other committees are moving in line with around 4 o'clock meetings, especially with some councillors having childcare issues and picking up from school, myself included. Following on from me asking this to be brought to the agenda, Councillor John Thomas has also brought it to my attention. It's an awkward time for himself as he has a contract with picking up children from school. Does anybody have any comments? Geraint, I see you have a hand up.
Yeah, Chair, it was in relation to the last report it was, right, so, but what I'll do now, because I know we're going to talk about the bus service a little bit later, so I'll make a comment right at the end, okay?
Okay, thank you. Scott?
Yes, sorry, I turned the camera off a sec. Yeah, obviously I understand that we're discussing the times of the meeting. As I expressed in the pre-meeting, it is a bit more difficult for myself and members of the Labour group because we tend to have our pre-council meeting that roughly follows what the proposed time is that you're making. It would come across as a bit difficult for certain members, so I think at the moment it might need to be addressed with a full committee rather than just the 3 of us at the moment.
Okay, thank you, Scott. Malcolm?
Yeah, I've got no issues with any time, Chair, so I'm happy to go along with whatever the majority propose. but like Scott says, perhaps it needs a discussion with more of us here.
Okay. Yeah, I was hoping it'd go to a vote today, or we'd all be in agreement. I'm going to suggest that we contact all councillors, and I'll set a date period, say a week's time, and give everybody a chance to respond, and then we'll set the meeting to the majority. I'm going to propose the meeting start at 4 p.m. I think that gives 2 hours, enough time for maybe the for Scott maybe and the other Labour members to get to their group meeting. So 4 p.m. And maybe a 3:15, 3:30 pre-meeting start. Is that agreeable?
Yeah, I think that would be a bit more favourable in respect to myself and my colleagues in the Labour group.
Yeah.
As I said, Chair, I've got no issues with any time, so it's fine by me.
Okay, brilliant. Moving on, agenda item number 5, work programme 2020-21, to consider attached report, pages 17 to 28. Maria, do you want to come in there? Does anybody have any issues with the work programme?
Sorry, Chair, I've got a dodgy mouse.
Sorry, I lost you then.
Yeah, not a problem, not a problem. Okay, so it's just to qualify in regards to the next meeting. There are 3 reports scheduled. The first of those is going to be the presentation which committee members agreed they'd like to receive from New Pathways, and that's going to focus in on the issue of sort of sexual violence and the impact of that across the communities of Merthyr. The second report scheduled for the next meeting is regarding the Crucible project and the developing SPV, the special purpose vehicle. And we've got the standard agenda item, which is the coronavirus response update report. So I just wanted to check that members are comfortable with the details which we're asking report authors to include in those reports, just so that we can ensure that report authors are able to meet the expectations of the committee.
I'm happy. Everybody else okay? If there's any concerns going forward, please bring them to mine and Maria's attention, and we can revisit it anyway.
No, nothing, Chair.
Okay, thank you. Moving on. So much paperwork here. Moving on to agenda item 6, scrutiny referrals, feedback and follow-up actions. I do not have any. Myra, Maria, do you have any?
None of which I'm aware, Chair.
No, Chair.
Okay, thank you. Agenda item 7, reflection and evaluation of meeting. Does everybody think it's going okay? Yeah.
Yeah, you're doing a good job, Chair. Carry on.
Yeah, thank you.
Yeah, Chair, based on the numbers, you're doing fantastic. Brilliant.
Yeah, nobody wanted to turn up. So, yeah. To receive an update from the Chair, I don't have any. Agenda item 8, any other business deemed urgent by the Chair? I do not have any. The next item, agenda number 9, is exempt. Would somebody like to move section 100 for me, please?
Chair, I'll move section 100.
I'll second that, Chair.
Thank you. Myra, are we okay to...